Mike Gogarty, Director of Public Health at Essex County Council. Are you pleased? Here we are now on March the 30th, 2021. Are you pleased with the progress the county and areas like Harlow has made?
So I have to say I'm very pleased with the efforts that the people of Essex have made in terms of this last lockdown, and we've moved from a place where Essex had some of the highest rates in the whole country, including Harlow, to a position where now we have the lowest rates in the east of England across Essex. Hollow's a little bit higher, but again, and Hollow's always been quite slow to drop, but Harlow is dropping quite pleasingly as well, and I expect the rates in Harlow to be below 30 within a few days. So they're dropping quite nicely at the moment. So I'm very pleased with the way things are going, but that is entirely due to the good efforts of people in terms of observing the lockdown. And as soon as that stops, the rates will go up again.
Okay. And we have this, what we call route map out. You know, we've just passed March the 29th, we've got April the 12th, and the dates in June. Do you agree that it's data, not dates? Do you agree with that as well?
Absolutely. No, this is, as you said, it's a map. If things go well, you get to the next one, the next one, the next one. And I think that the government are now quite rightly changed to the things they're measuring to say if it's going well or not. So the most important thing is vaccination. You must get vaccinated. If you don't get vaccinated, you may get the disease and you may die. There's no such thing as herd immunity in this because, first of all, we're not doing the children anyway. Secondly, some people will doggedly refuse the vaccine no matter what. And thirdly, the vaccine isn't actually 100% and it won't stop the spread of disease from person to person. So if you haven't got the vaccine, we're going to see very, very high rates, I think, of cases and disease within the population, because once there's no restrictions, we've got the Kent variant. There's no reason it shouldn't be just as high as it was at Christmas. The question will be whether or not the vaccination can protect people, stop them getting ill, stop them getting to the hospital. So the most important thing is to get vaccinated. The second change we've had since Christmas is that we can now have home testing. So all our libraries now, or from Monday, will be offering the opportunity for people to have home tests. So if you, as I do, are really keen to meet your family this weekend, why not have a test before you meet them? That way you're protecting the people you care about the most. If you're positive, you can call the meeting off. If they're positive, they can. It's easy to get tested, and most of the highest risk of infection is going to be between close families meeting, less so outdoors, but when we finally get to meet indoors. But certainly if you're visiting family, visiting older relatives, get tested before you go. The other thing we're trying to encourage people to do is to get tested regularly anyway, and that's particularly important for parents who've got children, because children and schools are a place where infection will spread quite a lot. But if let's say I get infected and I test myself and I find myself positive, then I can exclude my son from school so that the thing never gets in school. So parents, whether they should regularly test, symptoms or not, they should regularly test twice a week. Similarly, if you have to go out to work at a shop or something where there's lots and lots of other people, again, it's really important to get regularly tested. The important thing there is that we work with local councils, local populations to make sure that people aren't, there isn't a disincentive, so that hopefully as many people as possible won't lose out financially by doing the right thing. And I think the last thing for me is I think we need to rethink personal space. Yes, we can go to the pub. Yes, we can go to, sit in restaurants, but we need to rethink personal space. We need to, as much as possible, recognise 2 meters of personal space around anybody, because the thing can't jump 2 meters. So if we do that where we can, so in the queue at the shop, those areas where we're just queuing, we can keep the 2 meter thing. There's no reason not to. And so that will reduce exposure, even though obviously if we're at the bar by somebody, or we will be closer than 2 meters in a nightclub or something. So, but where we can, we should look for the 2 meter thing. So I think by doing those things, we got the best chance of coming out of this lockdown properly and reducing the chance of anyone getting seriously ill and dying.
Did you get any feedback from the testing in schools? Did you get any feedback and see it's higher amount of tests or positive or higher than you thought or lower than you thought?
So generally speaking, we have seen a modest increase in Essex in the rates within the secondary school group. But it has been quite modest, except in one area where we've seen a very, very high rate, due largely to a very major outbreak in one of the secondary schools there. But there's only been one. And of course, now they're all on Easter holidays. So the clever thing about the government's timing was they deliberately timed the opening of the schools so that there'd be a natural circuit break at Easter, so we can assess what impact they've had. So yeah, we've seen some increase, but generally not enough to turn the curve up at the moment, except for the one area where we have seen an awful lot of cases and a very high rate in the school age group. However, very, very positively to date, that hasn't been accompanied by an increase in the over 60s, which is the main worry.
I keep my stats on Harlow every single day. I put my reports on, and Harlow at one stage had something like about January the 4th or 6th, something 1,178 cases, and now from about the 14th of March, it's down to 49 cases. But it's now stuck in the 40s, 42. I know you go by rates per 100,000, etc. But what do we do if Harlow is still at that in late June or July? Because I look at sort of cities like Brisbane that are closing down with 7 cases, but what if a town like Harlow still has 49 cases or a rate of 48.2 per 100,000?
Yeah, I mean, I think that we need to start thinking about what you call enduring transmission, where the rates just won't drop. And then you need to understand exactly what is it in that particular area, that particular town that is leaving it resistant to reductions. And you're absolutely right. Harlow has been much slower to decline than a number of than anywhere else in Essex, I have to say. Having said that, I'm hoping that within the next 3 or 4 days it'll be down to 30.
Okay, but is there anything about Harlow? I don't want to blame my 85,000 neighbours, but is there anything about Harlow that could pinpoint that? Because you're not saying about Basildon or Southend or Malden, which I noticed. So what is there something we're doing wrong, mate?
So no, I don't think you're doing anything wrong. It may just be the geography of the place. It may be the way that the sort of jobs that people do in Harlow put them more exposed. They may be more out and about. It may be the nature of the families in Harlow, that how they're made up. I don't think there's certainly nothing the people in Harlow are doing. The people in Harlow have been fantastic. And in fact, Harlow, remarkably, was one of the places where we had very, very few cases for a very, very long time. So it wasn't a place where, like we're seeing Peterborough, Leicester, Luton, where you high rate straight away. It's generally been quite protected. I'm confident that the rates will continue to come down in Harlow. And I'm not saying that sort of through anything other than I've got a sneak peek at what the data is looking like in the next few days. And although the future data is not complete, you can get a sense from it. And the sense I'm getting from the Harlow data is it'll drop to the low 40s tomorrow. It'll be in the high 30s the day after. And if we're lucky, it might be as low as, no, probably won't be in the 20s, but it'll be in the high 20s, I think, by the weekend, if we're, with a fair wind.
So it's a lovely day today. It's March the 30th. We have these dates at April the 12th, as I said. But what's your message to people about the route map in the next couple of months? Is it just please, be vigilant?
So my messages are: if you haven't got vaccinated, get vaccinated. That is the single most important thing. If you've been invited for a vaccine, go and have it. If you get invited in the future, go and have it. I think if you haven't had it and there's a particular think you can't have it. So, for example, if you think you've got serious allergies, if you're allergic to penicillin or vaccines in the past, or you're immunocompromised, any of those reasons, contact me, talk to me about it, because actually, in most cases, it is safe to have the vaccine, or we can arrange for you for another vaccine in hospital in very, very rare circumstances. But the vast majority of people, it's really easy. But if you don't have the vaccine, you could get it, you could get very ill still. Think about testing regularly, particularly before you meet people. You can pick up tests at your local library. You can order them online very easily. And socially distance at 2 meters wherever you can. I think they're the main things.